COVID times. Welcome everyone to the June 7th, 2021 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Board of Health members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn, present.
Austin Magnet.
Austin Magnet, present.
Josh Briggs.
Josh Briggs here.
And then Bill Muller, I don't see yet. Let me make sure he's not. No, I don't see him yet. All right, and then staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Julie Van Arslan from the Alliance.
Affirmative.
Ooh, you're sounding really choppy, Julie.
Oh, no.
Now you're better.
Okay.
You just sounded, when you first started talking, you had that robot sound.
Okay.
And then Evan Broussard.
Present.
Right. I'd like to open the meeting. Get him. Oh, Dan.
Yep, this is Dan Finn. I make a motion to open the meeting.
This is Austin Magnet. I will second that motion to open the meeting.
All right, and then we'll do a roll call vote. Dan Finn.
Dan Finn, aye.
Austin Magnet.
Austin, aye.
Josh Briggs.
Josh Briggs, aye.
And Karen Gwiazdowski-Govin, aye. So good evening again, everyone. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we've been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. And there are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening via video conference via Zoom, as posted on the town's website, identifying how the public may join. Please note the meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because anything that you broadcast could be captured by the recording. Any supporting materials that have been provided to members of this body are available on the town's website unless otherwise noted, and the public is encouraged to follow along using the agenda that's been posted unless I note otherwise. Before we turn to the first agenda item, just some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I will introduce any speakers for each topic on the agenda. After they conclude their remarks, I'll go down the line of members, inviting any members to provide any comments, questions, or motions. Please remember to mute your phone or your computer when you're not speaking, and then please remember to speak clearly and in a way that helps generate accurate minutes. For any responses, please wait until I, the chair, yield the floor to you, and then state your name before speaking. If any members wish to engage with other members, please do so through me, the chair, taking care to identify yourself. And then finally, any votes taken this evening will be conducted by roll call vote. All right, I will not miss that once we all go back to in person. I know that I have pretty much memorized, I feel. So the first topic on the agenda is the Alliance update from Julie.
So I'll just start talking about the homebound vaccinations. Worcester Department of Public Health has requested data as to how many individuals have utilized the service in the Alliance communities. And once we receive that, we'll be able to share that with the communities. Also, Mass DPH has awarded Worcester DPH funds in the amount of $245,000+ for 3 years for a public health district cost analysis for the business model for the Central Mass Regional Public Health Alliance. It's been over 11 years that WIS has been providing services to the surrounding communities through the IMA. Additional responsibilities and skill sets have been added or required over the years. With that in mind, as well as maintaining the national accreditation for the Alliance, we welcome the opportunity to hire a consultant to work with us. And the expected outcome includes a cost analysis, long-term business model to support sustainability and capacity to maintain and expand public health services programs, initiatives, and policies. The Central Mass Regional Public Health Alliance will be holding a quarterly alliance meeting with the schedule, it to be scheduled over the summer, as well as meeting with the Alliance town managers or the town administrators to discuss the fees business model analysis. The invites will be sent out to the appropriate individuals in the next few weeks. Do you want me to go over the COVID-19 updates as far as the vaccine sites?
Sure, you might as well.
Would you like me to keep going
Sure.
on that? Okay, all right, because I know if you were going to talk about that. Okay, so the regional and mass vac sites are beginning to stand down. Worcester State University vaccination site held approximately 107 clinics over 17 weeks and provided approximately 83,000 vaccinations. The Mobile Equity Vaccine Clinic will continue through December. They received 338,000. United Way to hire a consultant until the end of the year. Also, my computer froze. I can tell you that I attended a MHAB special program on health and agriculture, Massachusetts. It was the evening of May 27th. Mass General Law, Chapter 111, Section 31, no hearing is required before enacting a reasonable health regulation. And that amendment took effect April 11th of this year. An act provided for agricultural commissions. They have input on municipal boards of health regulations. And the law has been revised as of January of 2021 to provide local boards of health may no longer pass any health regulation that impacts agriculture in a municipal community that has an agricultural commission without submitting any of their information for review first. Our staff is still continuing to work on rec camps, public pools, as well as farmers markets, events, and fairs. Also, one of our concerns is ticks and tick-borne illnesses at this time. I know that Karen has sent out some material to post on social media as well as cable access channels. And this is just to remind all the residents to take the necessary precautions when spending time outside and practice the 5 Ds. Pfizer COVID-19 vaccine is now authorized for vaccination persons 12 years of age or older. We are still taking part in case and contact tracing. This is by our public health nurses, are a member of the Mass Department of Public Health Community Tracing Collaborative. And the 5 Ds are drain, dress, DEET, dusk, dawn. And that would be drain anything, any kiddie pools, gutters, baths, covers as much of your skin as possible, wear long socks, some kind of repellent as well. It's a repellent that has an EPA registration. Dusk to dawn, peak mosquito biting activity occurs around dusk and dawn, avoid being outside at these times if possible. If you, I know that Amelia has tried to Council on Aging, was able to connect today.
Okay. You still there, Julie?
I think we lost her.
Yep.
It's interesting about the agricultural rule.
All right, we'll give her. Let's see, is she back? Yeah, she's trying to get back in now. Let me see if she's back.
Did I talk too much that you kicked me out?
Yep, that's it. You stole all my thunder for all the other topics. Oop. You're sounding choppy again.
Okay. I know it's fine. Like, do you want me to do it or do you want to do it? So plans are being formulated. Amelia contacted the can you hear me now?
Yeah.
So are being formulated blood pressure clinics at 9 Forest Lane at 30 Pro in Grafton.
Okay. I thought I heard something about that. Hopefully going to get started back up again and everything.
Yeah. They're anticipating, you know, Amelia's working hard trying to connect. So, and if you have any other questions for me today, I know that Karen sent out, I don't know if you received it yet, the full update, which has everything from, you know, community health to everything that Pat and Amelia are working on, from public health, nursing, emergency preparedness. And then there's a piece from us for environmental health as well, and then all of Karen's updates.
Right,
If
yeah.
you did not receive it, I can forward it over to you.
Yeah, probably is in Nancy's box and she was out today, so.
Yeah, so I'll forward it over to you, and if you don't mind, you can forward it over to everybody else.
Yeah.
Sounds good. Thank you.
Okay, yeah.
Dan, do you have a question? I saw you. Yeah.
I do. Karen, thanks. Julie, regarding the inspections for the month that Daniel completed, a couple of relatively simple questions, I think. I'm not familiar with First Bite. I'm assuming that's like a breakfast restaurant or business.
I can't answer that.
Okay.
I can't. I know that I've had the discussion with her, but I actually cannot recall
Yeah.
at this moment.
I mean, I
can-
know where it is in general, what they do, but I don't know. So they're in South Grafton near the old Trek stop, the old
Okay.
Stephanie's.
Yep. Thanks. So they may have changed ownership over the past year or so, I think, perhaps. And the other question, Julie, is regarding the hot dog stands, you know, on there. In other towns, do they typically require some type of toilet or porta potty or anything like that for their business?
If the hot dog stands on the side of the road are usually grab and go.
Yeah.
Typically a lot of them do not have
Restroom facilities.
portable toilets. Occasionally some do.
I
Yeah.
was just curious.
Yep.
Currently not in the town of Grafton, but okay.
And I did the pre-op inspection for the moving cow, which is a mobile unit for hard ice cream.
Yeah.
And that is going to be located at 15 North Main.
So that's like a food truck type?
Yeah, it's right near Rhodey Memorial Park
Okay.
and
All right.
Grafton Grill and Crust.
Yeah, cool.
All right. Thank you.
Because I saw her. I happened to just drive by that way and I happened to catch my eye when I saw it.
Cool.
Any other questions for Julie from the board members? Dan?
There we go. Thank you, Karen. Julie, we're getting ahead of ourselves a little bit, but off the top of your head, how many employees does the Alliance have, like full-time and part-time? I'm sure they've grown over the past year. And I know we lost one with Phil, which is too bad. but
Right.
How many do you think employees there are?
When we all get together,
Yeah,
I want to say 30,
wow, okay.
maybe. Yeah, because we also, so we have, our community health team is very large also. And they're also up, I believe, working up through City Hall as well with Dr. Castile. Dr. Castile's office is up at City Hall, so, but there's quite a few of us.
Yeah, I was just curious because I'm sure the organization has grown over the past year, certainly, year and a half.
Yeah, definitely has. And yeah. I know they hired a few new individuals, so hopefully soon we will be able to meet them. We haven't been able to meet anybody in person still, so hopefully soon.
Okay. All right. Well, thank you, Julie. All right. Next up is Evan with the Alliance Intermunicipal Agreement.
All right, thank you. Hi, everybody.
Hello.
So I can do this two ways. Do you want me to share my screen and put the IMA up, or do you want me to just talk about the change? Because it's just the money part.
I mean, if you want to just talk about it, that's fine.
Okay, I can do that. So really the major change in this, and the agreement has been reviewed by both Worcester's council and Grafton's council. The major change is an increase in the cost per year. So there's a 2% rise, which is across the board. And then there's a one-time fee of roughly $18,800, I believe it is. This is to try to recoup some of the lost revenue and lost revenue. We have revenue. Losses that they had due to additional workload due to COVID. And so what our plan is to, absorb the 2% regular increase in our normal operating budget and the one-time increase to go after ARPA funding for that. ARPA is the American Rescue Plan. We believe that this will qualify for that, and possibly this and more, but at the very least, just shy of $19,000 that we would then offset out of this contract. It is a one-year contract.
Okay.
Rather than, going for something longer. The board was interested in having other conversations, the select board. And so, I think that's a longer range conversation. My thinking being so new and, trying to get a budget through town meeting was to let's keep doing what we know works. And then, that gives us a year to discuss further, should we want to make any kind of change or a more substantive change to the contract or whatever we decide to pursue. But that's pretty much the bulk of it.
All right. Board members, any questions for Evan?
I have a question.
Austin?
This is Austin. How quickly do you guys think you could get the funds through the rescue plan? Will that
I have zero idea.
Yeah.
No, so here's what we're doing. We will, within the next 2 weeks, have applied for the ARPA funding.
Yep.
Not specifically for this, but we will apply for our first tranche, they call it. That's what the feds are calling. I don't know why. I've only heard the feds call money drops tranches, but anyways,
Yeah.
they're going to give us this first tranche. And then we've set up a committee, or we're in the process of setting a committee to help dole out that funding. Because there's a lot of different sources, or different destinations for these funds.
Yeah.
From public health to public safety to sewer, water, broadband, local business support, nonprofits. There's a ton of stuff you can do.
Yeah.
And so we want to make sure we're doing that responsibly. I will say, though, that it is one of my highest priorities to ensure that at the very minimum, $19,000 is going towards this contract, because I in no way budgeted for it. And so I don't anticipate that that's going to be a problem for us. I would think that, our application will be approved within a month. We've got all the way to the end of the fiscal year to come up with,
Okay.
that nut, because it's really just broken apart over our monthly payment, or that total thing. So, and Karen Clark is well aware that we would be using ARPA money for that component. So again, I don't foresee that being a real burden for us to lift. So
Awesome.
that answers your question.
Any other questions from board members? Dan?
Yeah, I think we'll all agree that the performance by the Alliance over the past year and a half has been superlative. 2% seems like a pretty reasonable increase to me. I don't know, maybe negotiations started higher or whatever, but just in my personal opinion, that's.
Yeah, it seemed reasonable to me. In fact, when Karen and I first started talking, she wasn't sure of the number, and I just jokingly repeatedly said 2%. So maybe I got that into her subconscious. But I mean, I think a 2% year over year increase is a reasonable increase. Given, consumer price index, inflation's 1.8 to 1.6, somewhere in there. Everybody's costs rise. I think it's a reasonable ask. And I also, quite frankly, think that, the $18,000 or almost $19,000 ask for, a 1 year recoup of COVID expenses is a fairly reasonable ask too.
Right.
Especially given that, we're going to be able to use this ARPA money to do that.
Right.
They could have easily come back and said, "Oh, we want 100 because we know you're getting $5 million." Right. And so that probably, I think a less rational group could have certainly done something like that, but
Right.
they calculated their costs out and broke it apart across the communities, and I think it's reasonable.
And again, going forward, I think they're going to be on the road a lot more this year. And if gas prices are any indication, that's hopefully they'll come down. But there's those kind of things that we have to anticipate, I'm sure too. So thank you.
Right. Yeah. Well, and their services are. This includes their mileage.
Okay.
So that's not it's a one shot deal. Now, does that mean we negotiate next year and they've got to account for that? Maybe. But we'll see what happens. I'd like to come back to another board meeting and discuss, kind of the long terms with you folks about where you see this going. The board the select boards talked about other options. I think that's what select boards do, and I think that's their role, is to look over this, policy umbrella and see, is this an effective way to do this? And I think, we'll have longer discussions about that. It was really just a race to town meeting at this point, having started at the end of February. So just fund everything, get everybody status quo and working and covered. And then, we can talk a little deeper moving forward.
Great. Thank you.
Sure.
Very reasonable approach.
Great. Any other questions for Evan? All right. I'm going to take that as a no.
Right. I'll take it.
All right. Well, thank you, Evan, for joining us.
Sure. Anything else while you have me here?
Not that I can think of. I mean, if you want to stay on and listen to.
I normally would, but no. I thank you all for everything you're doing. I think it's a great service that you volunteer for and provide to the town of Grafton. I never, even before the pandemic, quite frankly, the role of the Board of Health, I think, is so vital to everything that we're doing here. So I really appreciate everything. And, you can always reach out to me if you need anything. And like I said, I'd like to come back to another meeting and let's talk more long-range strategy.
Yeah.
All right.
Great, thank you.
For your support. And
Thank you. And with that, I will jump off.
all righty. Have a good evening.
Bye,
Thank you. You as well.
Thank you. All right, next topic, COVID-19 updates. It's the first time I can say that there's not a ton to update on. I'll do our usual case count. So as of June 7th, Grafton has been informed of a total of 1,187 confirmed positive cases since case tracking started back in early 2020. We have had I forgot the exact amount now, but it's at least a week now of 0 cases from a daily case count. Not that I want to jinx anything, but obviously we're continuing to be in the correct direction when it comes to cases, along with many other communities. It's not just us, obviously. All it takes is looking at the overarching numbers that are getting released by the state, let alone the map that gets updated on a weekly basis. And what used to be a lot of red and yellow across the whole Commonwealth is now pretty much a lot of gray, which Grafton is once again in the gray status for the second week in the row now. And that, just a reminder, is the lowest status you can have from a COVID perspective. But then you see there's a little bit of green and maybe a few yellows sprinkled across the Commonwealth now. So it has dramatically shifted over the past few months, which is obviously wonderful. And we do have vaccinations to thank for helping that along the way. As of, I'm not going to go back through what we talked about during the last meeting, other than now what was supposed to be effective May 29th is now effective. So all of the previous restrictions from industry perspective have been lifted. Capacity is back up to 100%. There's no more gathering limit. For private or public, from a face covering perspective, there's no more mask order. That became an advisory back on May 29th, where non-vaccinated individuals are advised to continue wearing face coverings and to continue distancing in most settings. And that fully vaccinated individuals no longer need to wear a face covering or social distance indoors or outdoors, except for certain situations. I do want to reiterate, though, that face coverings may still be required by certain businesses. And they are still required at this point for any type of public or private transportation. So your Lyfts, Ubers, ferries, MBTA, commuter rail, taxis, Knights Limousine, and in the transportation stations also, any healthcare facilities and providers, any congregate care settings, any health and rehabilitative day services also. And then at this point, face coverings are also required indoors for staff and students of K through 12 schools and early education providers. At this point, Governor Baker is still planning to end the state of emergency on June 15th, and the state is continuing to work with municipal and legislative partners during the period for transition. For example, think the in-person meetings that we used to have for boards and committees, this switch over to you don't need to be physically meeting in a location. You can now use Zoom. When that state of emergency gets lifted, if the legislation that's been put out there doesn't pass, that in-person meeting gets reverted back to. But it sounds like they're pushing to kind of transition that over a slower period, that it's not going to be immediately snap your fingers come June 15th and we all have to immediately go back to in-person meetings. So that's still out there. I haven't heard that that's passed or failed at this point. And there's other areas that Baker's been working on also, from proposals to kind of make it so it's not such a snap, all of a sudden everything just goes 100% back to normal with certain areas. Any questions on that before we jump to COVID-19 vaccine updates? All right. So from a vaccine perspective, back on April 19th, it opened up that anyone, now it's age 12 plus, who lives, works, or studies in Massachusetts is eligible to receive the vaccine. As Julie mentioned, the Pfizer vaccine is currently the only one for individuals that are 12 plus. And as we all know, the availability of appointments and vaccine has shifted. So it's much easier to get vaccine than it was a couple months ago, even, where people were, scrounging to trying to get appointments and everything. So even though we are definitely on the right path right now, we continue obviously to recommend that everyone who's eligible, who has not been vaccinated yet, to get vaccinated if you can, from a medical perspective. If there's any issues, obviously speak to your doctor. And then just, continue, although you don't need to social distance, you don't need to wear a mask, just continue common precautions, make sure you continue with the hand washing, et cetera, because we're not out of the woods yet at this point 100%. And there's definitely some pockets, even if they're not in Massachusetts, that are still having higher numbers. Any questions from the board members on vaccines? No. All right. Then the final topic was EEE, which is Eastern equine encephalitis. We haven't talked about it for a while. West Nile virus and tick season for 2021 is upon us. So just a reminder to the public, and Julie touched on this also, that, remember your 5 Ds. You dress in long sleeves and pants when possible when you're outdoors, especially during the periods of mosquito activity, which are commonly, known from the dusk period and then also the dawn period. Use effective repellents. DEET is the most common one that we talk of. Drain water from containers regularly, as Julie mentioned, kiddie pools, tires, gutters, etc. And, we have information up, I post it every year, on the Board of Health website for more info, helpful tips, some more details on things for those helpful tips. And then, for ticks, although it's not something that people thought of as much because of the whole big EEE issue a couple of years ago, ticks are still with us. Make sure, same thing, use a repellent. Watch what you're wearing when you're outdoors. Do a tick check on each person in your family who's been outside for a while, especially if you've been in wooded areas, grassy areas, etc. Be careful and really be diligent with looking at parts of the body that aren't so easy to see. Think behind your knees, your scalp, the hairline, armpits, etc. Places that you might not see. Don't just look quickly at your legs or your arms. Do a diligent check. And then if you have pets that go outdoors, make sure to check them. And I know that's easier said than done. I know people like in my neighborhood who complain every year because they have a really dark furred dog that's got really thick fur and it's just so hard to check. But be diligent, because if you don't find them on the dog, for example, then you might end up unfortunately finding them on yourself later on after they've, maybe come off the dog and walked around and then you've picked them up. So just, be cautious with both mosquitoes and ticks for the season. And here's to hoping that we luck out and do not have another EEE season like we had 2 years ago. So fingers crossed on that one. Any questions on that? Any members? Dan?
Thanks, Karen. Yeah, I think it might still be a good idea if we could have the Central Mass Mosquito Control Commission give us some kind of a report. They don't, not necessarily in person, but for our next meeting, just to see, or tell us where they're at in terms of the control measures, and if they're still offering to pick up tires and things like that.
Yeah, I know Nancy had that on the list because we knew by the time we talked about that, it was going to be too late probably to get actual info for this meeting. So.
Yeah.
All right.
I believe they're still going to be picking up tires, but it's usually a few times a year, and each resident has to call in for it. And also they are still treating untreated pools as long as the owner of the property allows them to go onto the property. And I just have one thing to add too. So for the arborvirus contact, it would be Pat Breckman would be the primary. And I just saw that I'm the secondary. So we will end up getting the information if there should be any, we will be passing it along.
All right.
Okay.
Thank you.
Yep.
All right. There are no more questions. Then I didn't see any mail or correspondence come through. So Austin, you're off the hook on that one. And then upcoming meetings, we have July 12th, August 9th, and September 13th. All right, so that's all we had for topics this evening. Dan?
Karen, looking at the upcoming meetings, they're all fine with me, but what are you personally anticipating? Do you think we're going to be remote for another month or two, or do you have a feeling for that?
If I remember the dating correctly in Baker's legislation, I think it went through sometime in September
Okay,
was the date if that was to go through.
Yeah.
I guess we'll have to play it by ear because state of emergency ends June 15th. One would assume the legislature would push through something like this and get it voted on, like what he filed, since June 15th is right around the corner. What they're going to do, obviously I can't predict that. So we'd have to really kind of play it by ear, because if that legislation doesn't pass, it's my non-legal understanding that then we'd revert back, the open meeting law would revert back to not just allow a Zoom meeting
right.
in placement. So we'll have to keep an eye and ear on how that progresses, because if it doesn't go the way that I'm sure most people are expecting, then we may end up in person in July and so on.
And with regard to the town hall municipal center, it's open now. If we wanted to drop into the Board of Health office or needed to, we don't have to go through paperwork or anything like that. Correct?
That's my understanding. It's been a while since I looked at it. I don't think you have to
Make an appointment.
go through appointment hoops or anything.
Okay, thank you.
All right. Well, if there's nothing else,
All right, well, this is Dan Finn. I'd like to make a motion to close the meeting.
First meeting in a while, yeah.
Adjourn, Mr. Word.
This is Austin Magnan. I will second that to join the meeting.
all right. And then a roll call vote. Dan Finn,
Dan Finn, aye.
Austin Magnet,
Austin Magnan, aye.
Josh Briggs,
Josh Briggs, aye.
William Muller,
Bill Muller, aye.
and then Karen Wisdowski Govin, aye. All right. Well, thank you, everyone.